So as I was saying, now when you look at the second and third costal cartilage, you can see a ligament fanning out, spreading out from it to the sternum. Again, in the fourth costal cartilage, it is present. Fifth costal cartilage, it is present. In short, in all the costal cartilages, it is present in all of your true ribs. Okay, how many true ribs do you have? 7 true ribs, right? So in all the true ribs except for your C1, R1. Don't forget your R1. R1 is special guy. Let him be. Okay, he is attaching to the manubrium. Now from the R2 till your R7, R3, R4, R5, R6, R7. Okay, you have a ligament radiating outwards towards the sternum from your costal cartilage. From this point towards your sternum, it is radiating outwards, right? Now this kind of a ligament, what do we call it as? When a ligament is fanning out towards the other end, we call it as our radiate ligament. Do you remember radiate ligament? Okay, where did we study radiate ligament? In the costo-vertebral joint, when it was articulating with the costal facet of the body of the vertebrae, we had a radiate ligament covering the articulation. In the similar manner, we have a radiate ligament over here. And what is a radiate ligament called as? Now this radiate ligament is going to be called as the sternocostal ligament. Sternocostalia radiata in Latin. Okay, ligamentum sternocostalia radiata. In English, it is just sternocostal ligament. Understanding this ligament which is fanning out from your costal cartilage of R2 till R7. Now, this radiate ligaments which is fanning out, when you look at them closely, what can you see? They are radiating outwards. Okay, fine, agreed. Okay, but look at the fibers of them. See here, these fibers are from this costal cartilage. It is going, but see, it is continuing on and it is joining with these fibers. They are covering your entire sternum. This is sternum cut in half. Okay, half of the sternum is cut, but look at the other half. It is completely covered in ligaments. Can you see this? The sternum is completely covered in ligaments. And where is this ligament coming from? It is the ligaments which is actually starting from your costal cartilage. Okay, those ligaments join together and they are covering your entire sternum. Okay, this is going to form a membrane on top of your sternum, and this membrane we call it as membrana sterni. Okay, or sternal membrane. Sternal membrane. Understanding? We have radiate ligaments from our costal cartilage connecting it to our sternum. That radiate ligament we call it as sternocostal ligament, and the ligaments of the sternocostal ligament are joining together. Okay, and they form a membrane on top of the sternum, covering the sternum, and this covering we call it as the sternal membrane. Understanding? No doubts, everything clear, hopefully. Now the next part over here, this still over here is your sternum. Agreed. What is this one called as? It's your xiphoid process, right? Xiphoid process. So the costal ligaments which are covering your xiphoid process, here also can you see the costal ligaments are intertwining among themselves and forming a ligament on top of the xiphoid process, right? So these ligaments we called as costoxiphoidea. Okay, costal and xiphoid combined, costoxiphoidea. Okay, the ligament covering your xiphoid process is ligamentum costoxiphoidea. Ligaments covering your sternum is called as membrana sterni. Radiate ligaments from your costal cartilage towards your sternum is called as sternocostal ligament. Okay, understanding? Interarticular ligament is what? Interarticular ligament is the one present in between the joint cavities of the second rib and your sternum. It is present at the junction between your sternum and manubrium. Okay, what else was there? Okay, so till now we have been, and in R1, do we have any cartilage in R1 attaching R1 to your manubrium? We only have the costal cartilage. Okay, there is no ligament. No ligament is there. Only our costal cartilage is present. Okay, now this was about your true rib, right? We have three types of ribs, right? What are the three types of rib? We have true ribs, which is from 1 to 7. We have false ribs, which is from 8 to 10. We have floating ribs, which is your 11 and 12, right? So true ribs, we saw how they are articulating. Now we will move on to our false rib. Okay, that is 8 to 10. In your textbook, it is given as 5th to 9th, but according to international data, standardized data, the false ribs are from 8 to 10. Okay, so these false ribs, why do we call them as false ribs? First of all, it is because they are not directly articulating to your sternum. Okay, what they are going to do is the 7th rib. Okay, this is the 7th rib, right? 7th rib articulating with the sternum? Yes, with its costal cartilage. Okay, the 8th rib costal cartilage, what is it going to do? It is going to come and attach to the 7th rib costal cartilage, and then 7th rib costal cartilage is attaching to your sternum. Again, 9th rib, what it will do? Costal cartilage will come and attach to your 8th rib costal cartilage. Okay, and your 8th rib costal cartilage is attached to 7th rib costal cartilage. 7th rib costal cartilage attaches to sternum. Again, your 10th rib, what it does? It is attaching to the 9th rib costal cartilage. From 9th rib costal cartilage attached to 8th rib costal cartilage. 8th rib costal cartilage attached to 7th rib costal cartilage. 7th rib costal cartilage finally attaches to sternum. So is it directly attached to sternum like our R4, R3, R2, everything? No, it is indirectly attached. It is attaching to the superior costal cartilage, and that 7th costal cartilage is attaching to sternum. That is why we call them as false ribs. Okay, they are attaching, but they are indirectly attaching. So these false rib which are attaching indirectly, they have a joint, right? The costal cartilages which are joining together, they have a joint, that is your interchondrales joint. Okay, it has a joint cavity. It is an actual joint. The cartilages are not just fusing together, it is a joint. Okay, so here we have a joint called as the interchondrales joint. What is the meaning of interchondrales? Inter means in between, right? It means between. Chondrales means what? Cartilage. Just like your os means bone, chondra means cartilage, right? So interchondrales means in between cartilage, the joint which is forming. That is what we call it as articulatio interchondrales, this one. Understanding? Now, this was for your false rib, which is articulating with the superior ribs costal cartilage. What about the floating ribs? What about them? They are floating. They are not attached to anything. So if there is no attachment, no ligament, nothing to study in your arthrosyndromology. Okay, only your costovertebral joint is present for your 11th and 12th rib, which is your false ribs. Floating ribs. Okay. So we saw the sternal membrane. Yes. We saw the costocyphoid ligaments. Yes. We saw the interchondral joint, yes, and here see they have mentioned 5th to 9th, but actually the false ribs are from 8 to 10, okay. And again here they have mentioned 10th rib is joined to the cartilage of the 9th rib by fibrous tissue. Yes, that is fibrous tissue, that is where the interchondral joints are forming. While the cartilages of the 11th and 12th ribs end freely, they are not attached to anything, okay, they are free. They can move as they want, they are attached only to your vertebrae. And what is the joint that is forming between the vertebrae? 11th and 12th rib has or have only costovertebral articulation, okay, articulation. Understanding? Your 11th and 12th rib freely floating ribs in the anterior side, attached only in the posterior side to the vertebra. So that's all is your rib. Your rib topic is done, costal topic is done, and here we have a picture of both, okay, your both your costovertebral joints and your costosternal joint, okay. Your costosternal joint, as we just studied, it's very simple. What do you have here? The first thing that we have here is the radiate ligament, right? See the radiate ligament coming into our sternum, sternocostal radiata, right? And then they join together to form the membrane covering your sternum, that is your membrana sterni. That's all done. And the one point which you have to remember is the ribs are here, the rib is ending here, okay. So what is actually connecting to your sternum? It is your costal cartilage, okay, this is your cartilage. Understood? And what cartilage is this? It is your hyaline cartilage, okay, it's your hyaline cartilage that is connecting. So that is your sternocostal joint. Now let's see our sternovertebral joint, which we saw in the previous video, right? So here what do we have? We actually have the radiate ligament. This is the radiate ligament, right? And inside the radiate ligament, what do we have? We have the capsule for the articulation, right? And over here they have removed the radiate ligament and they have shown only the articulation ligament. So what is this ligament over here? What is that ligament? Remember, that is your lateral transverse, sorry, that is your lateral costovertebral ligament, okay, the lateral attachment over here. Then what do we have? We have the costotransverse area, right? Here is your costotransverse attachment. One side they have cut the joint, the other side you can see the articulation ligament. This is your lateral costotransverse ligament, lateral costotransverse ligament, right? And the superior ligament is over here. Inferior ligament you cannot see because it is at the inferior part, right? This is your superior costotransverse ligament. Inferior ligament you cannot see, right? And the lateral ligament we have marked, and this is the joint cavity of it, okay. Understanding? And where is the tubercle of the rib? See this bulge is the tubercle of the rib. Hopefully you remember all that. So that's all. Our revision is also done for your costo articulations, right? Both your costovertebral and costosternal we have done. Next topic we will be moving on to the skull. Now in the skull, actually we have already seen the skull joints. What are the what do we call the skull joints? As suture joints, right? And the suture joints we have already seen. In case you want, I will just show you the suture joints and we will name them also. That's all is needed right now because we have already done all the bones and we know what all are the sutures over there. And what you have to know apart from the sutures is the fontanelles. Do you remember what are the fontanelles? I asked you to do it by self-study. I told you the age features are for self-study and you are to do it on your own. If you have done that, you would be remembering it by now. Okay. So here we have the skull as a whole. Okay. So since we have already finished osteology, you are going to name these bones for me. What is this bone? This is your frontal bone. Right, this is which one? This is your parietal bone. What is this bone? That's your occipital bone. And this center one, what is this one? This is your temporal bone. Right, and this part, what bone is this? This is your sphenoid bone. Right, what is this bone? That is your ethmoid bone, perpendicular part. Right, okay. So now in between these bones we have sutures. Right, where are the sutures? Let me mark between the frontal bone and parietal bone. This is a suture that we have. Right, between the parietal bone and the occipital bone, this is a suture that we have. Between the parietal and temporal bone, this is the suture that we have. Right, between the temporal and occipital, this is a suture that you have. Between the parietal and sphenoid, this is a suture that you have. Between the frontal and sphenoid, this is a suture that you have. Okay, this is the suture you have between your frontal and your ethmoid bone over here. Okay, understanding where the location of the sutures. Now since you are okay with the bones, we will remove all this and just the sutures we are going to mark. So between the frontal bone and the parietal bone, we have a suture over here like this. Now if you remember your introduction class for anatomy, you will remember the 4 planes of anatomy, which was a sagittal plane, coronal plane, transverse plane, and coronal plane another name, frontal plane. Okay, so try to guess, or actually you are not supposed to guess, you are supposed to know which plane this suture is in. Okay, this suture is going to divide the skull into front and back, right, anterior and posterior. So this suture is actually in your coronal plane. Okay, so this suture we are going to name it as coronal suture. Okay, the next one, at the back we have a similar looking suture between your parietal and your occipital. Okay, that suture we cannot name the same as coronal suture because it is actually curved. Okay, you know how the back posterior aspect of our skull is going to be? It is going to be curved, and the occipital bone shape is also not straight like the frontal. Right, it will be like this. The suture is going to look like this, like an inverted triangle. Okay, so that we call it as the lumboid suture. Lumboid suture. Okay, now this is in between the frontal, parietal and occipital, right, from the lateral view. You have to know the suture between the temporal bone also, but that is up to you. You can do it later. Okay, that's simple one. Where is the... Now that was from the lateral view, right? From the posterior view or from the anterior view also, you will be able to see another suture. What is that suture? That is a suture between your... Okay, over here we will see. This is parietal, frontal, occipital. If you cannot identify this, please go redo your skull bones. Okay, so between the frontal bones, between the frontal and parietal, we saw this was the sagittal, this was the coronal suture, right, sutura coronalis. Now between the, see the occipital bone, how the suture is going to be? It is like an inverted triangle, right? That is your lumboid suture. Now between the two parietal bones, Okay, you have a suture. You have a suture over here, right? Now tell me which plane is the suture in. This was in the coronal plane. Okay, so what plane is this in? That is your sagittal plane, right? So this is going to divide the skull into your right and your left half. So this is the sagittal plane. So the suture in the sagittal plane, we call it as the sagittal suture. Okay, understanding the three main sutures of the skull. If you know these sutures, it's enough. The other sutures will be easy, because in temporal bone we have the squama part, so that suture is going to be called as this squamal suture. Where is it? See, this suture is the temporal part, squama, right? Squama part of temporal bone. So that will be called as your sutura squamosa. Okay, now in between the frontal and sphenoid we have spinofrontalis, right? In between the zygomatic and frontal we have frontozygomaticus, right? Between the occipital and the temporal, the part is mastoid, so we have mastoidal, right? With the bone part, we know the main sutures which you have to know are the three which I just showed you. That is the coronal suture between your frontal and your parietal bone, right? And the sagittal suture between your parietal bones, and the lumboidal suture which is present between your occipital bone and the parietal bones. Now over here you have the fontanelles, right? I'll just explain it once because you are already supposed to be knowing all these. Okay, in the anterior part, what do we have? We have the frontal bone. So in between the frontal and parietal bone, in the superior part we have a fontanelle, this fontanelle. Okay, so that is your anterior fontanelle. Okay, in the coronal suture at the superior part you have that. At the same way, in the coronal suture only, at the inferior part, okay, angle between your frontal, parietal and temporal and sphenoid bone, okay, you have a fontanelle, that is your sphenoidal fontanelle. Okay, same way in your lumboidal suture you have a superior fontanelle called as fontanelle posterior. It's in the posterior part of the skull. Okay, and at the inferior part of your lumboid suture you have another fontanelle called as the mastoid fontanelle. Understanding between your occipital bone and your mastoid part of temporal bone. So what are the four sutures that you are supposed to know? First, you have to know the anterior suture, you have to know the posterior suture, major two sutures, you have to know these, okay? Then you have to know the sphenoid suture and the sphenoid fontanelle and the mastoid fontanelle, not suture, fontanelles. Anterior fontanelle, posterior fontanelle, sphenoid fontanelle, mastoid fontanelle. Understanding the four fontanelles which you are supposed to know? If you have not done the age features, again I am reminding you, please go do that. It is not something to be skipped. Okay, you need to know that in your embryology. When you start with your embryology topic, you have to know that also. It is not just for option. If you want, you can do. If you don't want, you don't do. No, it is not like that. You have to do. Okay. So with this, we are finishing our skull arthrosyndesmology also. We have finished vertebrae, ribs and our skull. The next topic is obviously your facial bones, right? So the facial bones, what is the facial bone articulation that we have to see? We have only one articulation, right? Everything else is suture, just like how we saw in the skull bones. Okay, so everything else is suture. Only one articulation is present that can be said as a proper joint articulation, right? Which one is that? That is your obviously mandibular joint, TMJ, temporomandibular joint. Okay, so we are going to start with our temporomandibular joint or commonly called as the TMJ. TMJ. Okay, temporomandibular joint. Now, as the name suggests itself, temporomandibularis, right? It is between the temporal bone and the mandible. A little bit of osteology. The head of the mandible is going to come and attach in the mandibular fossa of the temporal bone. Okay. Now, in that part, we are going to have movement or not. Is it movement possible joint or is it not impossible joint? It is a movable joint only, right? That is why we are able to chew, we are able to get nutrition, we are able to talk, we are able to sing, everything, right? Yell, everything. Okay. So this movement, this joint is a movable joint. And what is a type of joint? It is an ellipsoid shaped joint. Okay. We have types of joint in after our synovial joint. We saw the types of joints, right? So in that we have the ellipsoid joint. Now what does an ellipsoid joint mean? It has an ellipsoid shaped capsule. Okay. Towards that your oval shaped, oval or ellipsoid, this can also be told as an ellipsoid. A part, ellipsoid shaped part is coming and attaching. So this kind of joint is your ellipsoid joint. Understanding the shape of your ellipsoid joint. Now, which surface is concave here? Your mandibular fossa is concave. Okay. Your head of the mandible is convex. Okay. It is like a ball and it is going to go and attach to the articular mandibular fossa. Okay. Now, the articular fossa, it has two parts. Okay. The joint from the temporal bone view, it has two parts. It is extracapsular and intracapsular. Okay, it's going to be 30 minutes. The video will be too long. I'll continue this topic in the next video.